Is youth sex a risk? Secular culture, education, and even government tell our children and teens that they have the right to engage in sex as long as they do so consensually and use a condom. Is the issue of youth sex really that simple? Welcome to the video series Targeting Success for Youth. In this video series, we are answering 4 frequently asked questions about the issue of teen sex. This is video number 3 in the series where we are examining the question, is youth sex a risk? And our focus is on the physical risks. Hi, my name is Phil, and I'm with Peace Education Services, where we have been equipping parents and youth on the issue of healthy sexuality for more than 20 years. In the introductory video, we said that the goal is to get our children from the island of childhood safely to the shoreline of adulthood, where they can begin to achieve their life goals. The challenge is to get them across the risky waters of the youth years, where the risks of sex, drugs, and porn can negatively interfere with achieving their life goals. In video number 2, we examined the other risks associated with youth sex: social, emotional, relational, academic, and even economic. In this video, we are focusing on the physical risks: pregnancy and sexually transmitted infections. When it comes to teen births, the Canadian Pediatric Society reports that there are 13,000 births to teens each year, and that teen mothers have higher rates of mental health problems, substance abuse, repeat pregnancy, domestic violence, lower self-esteem, and lower educational achievement. Of great concern is the negative impact on the children born to teen moms. These children have cognitive and speech delays, often have behavioral issues, reduced academic achievement, and yes, early sexual activity, often continuing a dysfunctional generational pattern. When it comes to sexually transmitted infections, there are 2 categories of STIs: bacterial and viral. Bacterial infections, these can be cured with antibiotics. Viral infections, however, there is no cure. You often have them for life. If symptoms do occur, then these can often be controlled with medication. It's most important to note that with both types of STIs, you will often not have any symptoms, but you are still infected and able to transmit the infection to other people. STIs are transferred through sexual activity. This can include vaginal sex, oral sex, and anal sex. Infected body fluids can also be transferred on fingertips. In addition, some infections can be transferred by skin-to-skin contact or even through deep kissing. People often ask, Phil, what's the difference between an STI and an STD? Well, an STI enters the body and begins multiplying, but you do not know it because you have no symptoms. The infection becomes a disease when the symptoms are present. It's very important to remember that the infection can lie dormant in your body for years. Years later, when you decide to settle down and marry, you may still unknowingly be infected. The infection can be transferred to your spouse, and the symptoms develop into a disease. At times, this disease can become a form of cancer in your partner. There are more than 25 different STIs. For this report, let's consider the most frequently reported STI, chlamydia, which is a bacterial infection. What's the trend for chlamydia? Well, the Canadian government has been tracking chlamydia rates since 1991. In 1997, chlamydia reached its lowest reported rate. At that time, schools were mandated to begin instruction in condom use. Since then, although pregnancies have decreased, rates of infection for chlamydia and all other STIs have increased greatly. This slide compares the rate of increase of chlamydia by ages. The lower black line is the overall rate of chlamydia infection averaged out for all ages. In 2018, there were 363 cases for every 100,000 people. The blue line represents the infection rate for teens, which is 4 times higher. And the orange line represents the infection rate for young adults aged 20 to 24, which is 6 times higher than the overall rate. And these rates are likely underrepresented because 60% of chlamydia infections are asymptomatic and therefore often not diagnosed, but people are still transmitting. On this graph, we can compare the infection rate between boys and girls. The bar graph for 15 to 19-year-olds shows that chlamydia infection rates for girls is 3 times higher than for boys. What are the health risks of chlamydia? Well, for both males and females, the exposure to chlamydia can increase the risk of HIV infection transmission. If sexually transmitted infection becomes symptomatic, it can be seen as an inflammation in the rectum, the eye, the throat, or the urethra, which is the tube that transfers urine from the bladder outside the body. In males, STIs can result chlamydia can result in an inflammation of the testes and the epididymis, which is the tube around the testes. If this is untreated, this can affect the DNA of the sperm and lead to infertility. In females, chlamydia can lead to inflammation of the cervix. If that is left untreated, it can progress into pelvic inflammatory disease, which can lead to scarring of the fallopian tubes. Let's look at what happens in some detail. In response to the chlamydia infection, the body's immune system forms a pus-filled abscess around the infected tissue in the fallopian tubes or the ovaries. This can be very painful and may take months to heal on its own. If not treated, it can cause even further damage. This image shows how the fallopian tubes can become blocked by an abscess. Blockages make it difficult for sperm to meet and fertilize an egg. When you are an adult and want to begin a family, this can make you infertile. This image is that of a tubal pregnancy, also called an ectopic pregnancy. This happens when the fallopian tube damage keeps a fertilized egg from moving through the tube to the uterus. Instead, the embryo starts to grow in the fallopian tube. The fallopian tube can't stretch like the uterus does. When the embryo reaches a certain size, the tube may burst. This can be life-threatening for the mother and is always fatal for the embryo. It's important to note that pelvic inflammatory disease can spread to other parts of the body. Bacteria can leave the fallopian tubes and infect the abdomen and nearby organs. In this video, we examined only one sexually transmitted infection. There are more than 25 different types of STIs, and some types have up to 100 different strains. The most common types of STIs are listed on the slide. In school sex ed classes, youth are told to use a condom during sex to prevent the spread of STIs. Unfortunately, youth are not told that condoms only reduce risk. For example, if a partner is infected with chlamydia and the condom is used consistently and correctly during vaginal sex, the condom will only reduce the risk of infection by 59%. In other words, there is a 41% chance that the infection will be transferred. Our youth need to know this. In summary, is youth sex a risk? Well, we just covered the physical risks, pregnancy or acquiring an STI. In video 2, we covered the other risks, psychological, relational, academic, and economic risks. Risks that a condom will not prevent. Alternatively, the research shows that youth who avoid non-marital sex often avoid the negative lifelong consequences and are better equipped to achieve their life goals. So, is youth sex a risk? Yes, it is. Youth sex can significantly interfere with our youth achieving their life goals. Thank you for your interest in this important issue. Series, if this video has been helpful, please click the like button and you will be notified when new videos are available. Peace is dedicated to equipping parents and youth leaders to empower youth with the knowledge and the skills to protect their future by making optimal sexual health decisions. If you have an issue or a challenge that you or your child is facing, please send us an email. You can be sure that others share the same concerns, and we may be able to develop a resource to help. I look forward to connecting with you in the next video. Take care, and God bless you.